Good afternoon. Thank you for joining us today at the Mandarin Senior Center, one of two Jacksonville vaccination sites we operated earlier this month, and a site where we will be providing second doses. Joining me today are Dr. Charles Moreland, Director of Community Affairs, and Dr. Brad Elias from Jacksonville Fire and Rescue Department. Both of these gentlemen have been instrumental in organizing our vaccine and testing sites for the city of Jacksonville. I've also got with me Councilman Vice President Sam Newby and Councilman Boylan, who represent this district, who are with us today. And Councilman Boylan will come up after I give a few remarks to speak to the constituents of this area. We're here today to provide information about the process for administering the second dose of COVID-19 vaccine to those individuals who received their first dose here at the Mandarin Senior Center or the Lane Wiley Senior Center on the west side. Patients will receive reminder phone calls the day before their scheduled second dose. That's reminder phone calls directing them to report to the site where they received their first shot. They will need to bring identification and the shot record they received at their first appointment. To save time, they should also bring a signed copy of the consent form available at www.coj.net/COVID vaccine form. Printed forms will be available at the centers if you are unable to complete the form prior to arriving at the vaccination site. To ensure social distancing, and most importantly, so that our seniors do not have to wait in long lines, we're asking folks to come to their appointments during specific time frames according to the first letter of their last name. First letter of their last name. This is a way to keep things organized and running smoothly. If your last name begins with A, B, C, or D, come to the site 21 days after your first dose between 9 a.m. and 10 a.m. That's A, B, C, or D, 9 a.m., 10 a.m. If your last name begins with the letters E through H, come between 10 and 11 a.m. I through L, 11 and 12 p.m. M through P, 12 p.m. and 1 p.m. Q through T, come to the site between 1 p.m. and 2 p.m. If your last name begins with U, V, or W, come between 2 p.m. and 3 p.m. And finally, if your last name begins with X, Y, or Z, come between 3 p.m. and 4 p.m. I know I've just gone through a number of last names and the letters. You can find those also on our website. And if you're tuned into your local news, I'm sure they'll be recapping all of the instructions here. If for some reason you cannot come at your designated time, we're asking you try to arrive between 4 and 5 p.m. on that 21st day. Again, these times are only for those who received their first dose of the COVID-19 vaccine at either the Mandarin or Lane Wiley Senior Centers. Please make sure you return to the location where you received your first dose. If you want to review the information and instructions I just mentioned, it will be posted immediately following this press conference at coj.net, coj.net at the bottom of the page. I'm proud of our team for putting together these two vaccination sites. They've done an excellent job in making this a safe, efficient, and smooth process for patients and staff. They've demonstrated with full clarity that the city is ready and able to assist widespread vaccination efforts if and when more supply becomes available to us. For now, however, first dose vaccination appointments for our area are only being administered at the Florida Department of Emergency Management site at the Regency Square Mall location. This site is open 9 a.m. to 5 p.m. 7 days a week. Appointments can be made by calling 866-200-3762, 866-200-3762. Again, thanks for joining us and sharing this important information for the people of Jacksonville. Before we answer questions, I'd like to ask Councilman Boylan, who represents this area, to come up and address constituents.
Thank you, Mr. Mayor. I asked the mayor if I could just take a quick minute to acknowledge this, and maybe he may not recall this, but back in March, I sent him a text. And I said in that text, your legacy, one of your legacies of your administration is going to be how you take care of our citizens during this pandemic. And I want to commend him on many, many levels, he and his administration, for the support they've given all of us in this process. It's never easy. It's all brand new. As he said today has been a learning lesson for them. They learned from the experience of the first first rounds of vaccinations and what they're doing for the second. So I just wanted to take a moment to acknowledge and thank the administration for bringing it here into Mandarin. I appreciate that. And the fact, too, that they stepped up. The DOH, as you know, was responsible for this, but the city saw there was a need and filled it. So, again, Mr. Mayor, I just want to commend and thank you for your leadership. And I truly do believe, as we look back, as history looks back at this time, it will certainly know and appreciate your leadership as we got through this difficult time. Thank you, sir.
Thank you, Councilman. And we are available for questions.
Vaccine availability. You've been working on that, trying to get other city sites open. What's the frustration for you, and what do you really want to let people know?
Well, I think, first of all, as the supplies come in from the federal government to our state government, the supplies they have recently, as you know, moved that to central location in our city, in our county. They've done that in other cities and other counties. That's based on the supply they have at this moment in time. I've had direct conversations with Jared Moskowitz and others in the administration. When they get sufficient supply to move beyond those locations, the city will have the opportunity to get some of that supply and begin administering at those sites again. They see that we've done it efficiently. They've seen that we've done it responsibly and in a safe way. So, as the federal government works to get more supplies to Florida and then more to us, that's what we're waiting for. And look, it's easy to be frustrated. The situation is what it is right now. A very large organized effort that has to happen all over the United States, to all of the states and all the cities and counties. So my goal is to build relationships and work with people to get the vaccine to the people of Jacksonville as quickly as we can. No politics, no games. We're all in this together to try to eradicate this virus.
Mayor, are you happy with the job that the state is doing to get the vaccines to Northeast Florida? And also, are you happy with the job that the federal government is doing to help as well? And then also, what is the city doing to make sure that communities of color have access to the vaccines going forward when we get more shipments?
Yeah, first I'd say the state, we've worked very closely with them when they had the first round of vaccines. That's how we secured the supply we had to do these first and now upcoming second doses. So right now, they simply don't have adequate supply to move beyond their existing plan and into city sites. When they get that, I'm assured we'll have that opportunity, and they've demonstrated nothing but that. Look, I'm not intimately involved with the federal government's plans to distribute this. So I believe they care about the people. I believe they want to get it out to states and to cities and doing everything they can. And I want to be a productive part of this process and work with people to get the vaccine here and get it to the people of Jacksonville. As it relates to African American community specifically, of the ability to set up more sites in other parts of the city is based on supply. That's just where we are right now. I think it's important. I know that we have had leaders in our city, in fact, leaders around the state and the country that have demonstrated the importance of this vaccine for all people, that there are people that have a natural tendency based on history to be concerned about the vaccine, but that it's safe and that when it's available to you, you should take it.
What can you tell us about, we've been getting some questions about homebound seniors. I know that the city may be limited on what it can do, but is there anything that can be done at the city level to make sure that homebound seniors can get the vaccine because they have mobility issues? They cannot be coming to the Mandarin Senior Center.
I'm going to let actually Dr. Moreland answer that question, and he can probably also, I know he can, give you more insight on supplies to minority communities as well, because you've been working on that.
Thank you, Mayor, and thank you for the question. At the end of the day, our goal is to get the vaccination to our most vulnerable communities, 65 and older. The mayor has made it pretty clear to the administration that that's what he wants to do when the supply is available. So, we've been looking at opportunities, ways in which we can accomplish that goal, but we're waiting on supply to be available to us in order for that to take place. But rest assured that we understand the need in the community, and we're going to do everything in our power to make sure that we fulfill that need the community is asking for. And what was your other question?
About homebound seniors, how can they get the vaccine?
Yes. To that point, the Department of Health, our local health department, working through the Department of Emergency Management at the state level, works to develop plans to get to those seniors that are homebound and that can cannot make it to a vaccination location like the one we're at here, or the one in Regency, or the one at Lane Wiley. So they're working on a plan for all of that to ensure that all seniors 65 years and older have an opportunity to receive the vaccination if they like.
Just real quick, Mayor, how long is this going to be lasting? How many days will you be offering the second dose? And if people can't make it in that time frame, what should they do?
So our goal is to conclude here after February the 12th. We've been operating in these locations, Lane and Mandarin, for about 11 days. So February 12th, we should conclude the second dose for those who received the first shot. And we're hoping that everyone, based on all of our efforts, we're putting out robocalls, text messages, emails to try to reach the population that came to either Lane Wiley or Mandarin to get the first shot. We're trying to reach them to encourage them to come and get that second shot. It is very important to get the second shot. It's almost like completing the circuit. You can't just get the first shot, you need to come back and get the second shot. So the mayor has charged his team to do everything in our power to make sure everybody has all the information available to them to get back to either Mandarin, where they originally got the shot at, or Lane Wiley to get that second vaccination. But we're hoping February the 12th, we can put a bow on what we've been doing here over the past several weeks.
Yes, Mayor, part of the supply issue is the pharmaceutical companies can only make the vaccine so fast, and so they've got constraints too in the manufacture of it. And we're hearing reports it's going to be months really before there's enough out there for everybody to get the vaccine who wants it. So I just want to ask you as mayor, I mean, the prospect of going through this for months of the vaccination, do you think residents are prepared to kind of hunker down and wait that out? It does seem like that's a reality of the situation for the next few months, doesn't it?
Well, I think that's exactly it. And we have to face the reality of the situation we're in, which, if you go back, the little history lesson in all of this that we've lived, but it's easy to forget. We started this in March with a lot of unknowns as this virus was arriving in the United States, and we saw what was happening in other countries where healthcare systems were on the verge of collapsing, and some experienced tremendous pain. And the goal was always to protect our health systems, to make sure they could not only treat COVID patients, but they could treat all the other patients they needed to as well. And models suggested that maybe we wouldn't be able to do that. And therefore, there was a period of time where most of the country was at some form of stay-at-home order. Some states still have that. We in Florida and in Jacksonville moved beyond that before we got into the summer, and I said then, I say it again, as long as the virus is with us, until we have people vaccinated, we're going to have to learn to live with this and live with this in a responsible way. One of the simplest and easiest tools we don't have many tools, but one of the tools is wearing a mask. That's why we have a mask mandate here in Jacksonville. It's a very simple tool to do to slow the spread. The other thing is to act responsibly, but I believe that look, our kids are in school. I believe that our superintendent and the teachers are doing that responsibly, and I think that's important. People are working in a responsible way, and I think that's important. So I think we just have to face the reality that it's going to take time to vaccinate everybody, and in that time, we're going to have to bond together and do all the things, wash our hands, wear masks when we can, socially distance, and be smart about gatherings and crowds.
One other question, Mayor. The state has been opening vaccine sites in public stores in other counties, has not done that for Duval County yet. When there is more supplies, do you have a preference as far as whether you'd like to see that supply go to getting these city-run sites up and running again, or whether, if it's a choice, you'd prefer to see Publix be a location for these type of vaccinations?
Look, I would like our city sites to be able to operate and distribute the vaccine supplies. However, that said, I know the governor and his team are committed to getting this distributed as efficiently as possible. And if we get more vaccines at Publix or any other site in this county and city, and they can vaccinate people, I'm going to cheerlead it for it and be happy about it, because that means more people will be safe.
I know you somewhat addressed this, but the statement coming out from the coronavirus task force at the White House basically saying Florida should shut down bars and restaurants, and they say it's a mistake that that's not happening. What do you think?
I think that the harm done by shutting down places of business, by people not being able to earn, the mental health stress, I think that you have to balance all that. And my personal belief and decision as a leader in this city is that those establishments ought to be able to operate in a responsible way like we have been doing for months now. And people that are at high risk should take different actions, should not be particularly out in those types of spaces. And if you have someone that you come home to every day that's a high risk, that ought to impact your decisions as well. So I'm supportive of our schools being open. I'm supportive of our business being able to operate. Just do it in a smart, responsible way, which we have demonstrated in this county and in this city for months now.
I imagine obviously all the people who got their first shot are going to be paying attention to that phone call and want to come and get their second. But in the event that you're not able to reach some of the people who got the first dose and it's February 12th and you want to wrap this up, what's going to happen to leftover doses if you do have them?
Dr. Moreland?
We're committed to reaching all of the individuals, the 11,925 people that came between Mandarin and Lane Wally. We're committed to reaching those individuals. And every day when we wrap up, our goal is to look at that list because we got it alphabetized to the point where we know what day they came to what time they came. If we scratch through that list and those individuals are not accounted for, we're going to make a phone call, even may make a trip to visit them. We're really committed to trying to make this work for the community. We realize, the mayor, the team recognize that getting the first shot is just the first step. We got to get you to get that second shot. And so we're going to turn over every stone we possibly can to ensure that that happens before the February 12th time in which we conclude this operations.
Just to clarify, if there are leftover, hopefully there aren't,
Yeah.
but if there are, they won't go to waste.
No, we're never, nothing will go to waste. And again, our hope is that at the end of the day, everybody that was supposed to get the shot in the arm, get the second shot in their arm, but we will not have any waste.
Let me just close and add to that question about the coronavirus task force recommendations. It's important that people know that this isn't an us against them thing. This is their opinion, their expert opinion. There are other experts that have other opinions. We're human beings. Those of us that were elected to make decisions have to take that information and make the best decisions that we can. So it's just a difference in opinion at this moment in time about how we here locally and in this state navigate the coronavirus. We've got to stop. There can be policy disagreements that happen between Republicans and Democrats, but this nonstop us against them stuff has got to stop, particularly as it relates to us navigating and dealing with vaccinating people, COVID-19, and making sure that people are acting safe, responsibly, in a safe way. Thank you very much.